Clinical Dermatology and Dermatitis. COP study regarding leprosy amongst doctors of a tertiary care hospital, New Delhi. ISSN 2631-6714. Open Access Journal. Clinical Dermatology and Dermatitis. COP study regarding leprosy amongst doctors of a tertiary care hospital, New Delhi. Sandeep Chowdhury, Senior Specialist and Assistant Professor, Department of Dermatology, ISAC Jimsar and Model Hospital, Basadurapur, New Delhi, India. Rohini Soni, Second Year Postgraduate Resident, Department of Dermatology, ISAC Jimsar and Model Hospital, Basadurapur, New Delhi, India. Pascal D'Souza, Head of Department and Director, Professor, Department of Dermatology, ISAC Jimsar and Model Hospital, Basadurapur, New Delhi, India. Tapanku Murdali, Professor, Department of Dermatology, ISAC Jimsar and Model Hospital, Basadurapur, New Delhi, India. Archana Lakhand, Senior Resident, Department of Dermatology, ISAC Jimsar and Model Hospital, Basadurapur, New Delhi, India. Article information. DOI 10.310/CDD.20181101. Article type: Research article. Journal type: Open access. Volume 1, Issue 1. Manuscript ID: CDD 1101. Publisher: Boffin Access Limited. Received date: February 1, 2018. Accepted date: March 5, 2018. Published date: March 10, 2018. Corresponding author: Sandeep Chowdhury, Senior Specialist and Assistant Professor, Department of Dermatology, ISAC Jimsar and Model Hospital, Basadurapur, New Delhi, India. Telephone: 91,910,084,482. Email: suncutis@gmail.com. Citation: Chowdhury S., Soni R., D'Souza P., Dolly T. Lakhand. A COP study regarding leprosy amongst doctors of a tertiary care hospital, New Delhi. Clin. Dermatitis. 2018 Mar. 11-101. Copyright 2018 Chowdhury S., et al. This is an open access article distributed under the terms of the Creative Commons Attribution 4.0 International License, which permits unrestricted use, distribution and reproduction in any medium, provided the original author and source are credited. Abstract. Objective: to assess the level of knowledge, social attitude towards patients, and diagnostic capabilities of doctors, KAP, regarding leprosy, practicing at Tertiary Care Institute of New Delhi, India. Study design: cross-sectional, observational study. Materials and methods: a pre-tested and pre-validated questionnaire consisting of 21 questions was administered to 300 clinicians working in various specialities of this tertiary care hospital. The questionnaire covered all aspects of leprosy, including clinical features, diagnostic methods, duration of treatment, stigma, etc., to test the knowledge and attitude of a clinician towards the patient of leprosy. The collective sum of correct answers marked by respondent doctors was taken to classify them. Respondents who marked more than 15 questions correctly were considered to have excellent knowledge, whereas those aggregating 10, 15 and 5, 10 correct answers were classified to have good and average knowledge respectively. Participants with less than 5 correct answers were marked to have poor knowledge. Results: a total of 300 doctors were included in the study, out of which 262 gave consent to answer the questionnaire. 24 doctors, 9.18%, doctors had excellent knowledge, whereas 26, 9.92%, doctors had poor knowledge about the disease. 94, 35.87%, and 118, 45.03%, had average and good knowledge about the disease respectively. Conclusion: there is deficiency in knowledge and practices about leprosy amongst clinicians, which needs to be improved to bring down the prevalence of this disease globally. Keywords: leprosy, Hansen's disease. Introduction. Leprosy is a chronic infectious condition caused by Mycobacterium leprae. This disease is known to mimic various dermatoses as well as many systemic disorders, as it has a wide range of clinical presentations. It can present as single hypopigmented patch with mild to severe hyponesthesia, or can present with a wide range of deformities including loss of vision, deformities of hands and feet, autoamputation, resorption of digits and many others, which can be attributed to the multi-system involvement of Hansen's disease. Therefore, it is prudent to have a good knowledge about this condition so that no case is missed out by the clinician. The WHO reports showed that after 2015 the global registered prevalence of leprosy was 176,176, which was 0.18 cases per 10,000 population, and incidence was 211,973, which was 0.21 per 100,000. 1. In India, according to the NLEP report of 2015 to 2016, the prevalence rate was 0.69 per 100,000 population, and the annual new case detection rate was 127,334, which translates to 9.71 per 100,000 population. 2. It was further reported that state of Bihar showed highest case detection rate amongst the data available from all other states in the country. Delhi, being the capital of India, is a central place for all the immigrant population, and this could be a probable cause of high prevalence rate of leprosy in this region. For a common person, medical officer, general physician, is usually the first level of interface with the public and constitutes the backbone of healthcare services in any country. 2. Therefore, it is necessary to ascertain whether the general practitioner, GP, who refers the suspected/affected individual to higher centers for the treatment has adequate knowledge about the clinical features, progression and outcome of the disease process. In view of above, it was proposed to assess level of knowledge, social attitude towards patients, diagnostic and management capabilities with regards to various aspects of leprosy in the medical officers, MBBS graduate, of a tertiary care hospital in New Delhi, India. Methodology. This study was conducted in a tertiary care hospital, New Delhi, from the period of April 2017 to June 2017. Doctors including medical officers, residents undergoing post-graduation as well junior residents in various specialities of this hospital were enrolled in the study. Doctors who had previously worked in leprosy clinics and those who are presently practicing in dermatology department were excluded from the study to avoid bias in the result. A carefully structured questionnaire comprising of 21 questions was administered to all doctors included in the study. The questionnaire was designed to cover various aspects of Hansen's disease, including the clinical presentations, treatment modalities, attitude towards patients, leprosy as a social stigma and other parameters pertaining to the disease. All the questions were either having answers in yes, no or in multiple choices. Respondents were asked to tick appropriate answers in the proforma. Some of the total correct answers marked by the respondents were taken to classify knowledge of leprosy amongst doctors. A score of 0-5 was considered as poor, 6-10 as average, 11-15 as good and more than 15 as excellent. 3. All the proformas were evaluated at the end of the survey, and the responses obtained were evaluated using statistical program SPSS version 16.0. Pearson's chi-square test was applied among categorical variables. 3. Results. This study included the response of 300 medical officers, MOs, out of which 262 gave the consent and complied by filling the survey questionnaire. Out of 262 doctors, 178 were males, 68%, and 84 doctors were females, 32%. More than half of MOs were posted as medical officers in various specialties. This study also included students undergoing post-graduation, 48 in number, excluding those who are already working in the Department of Dermatology. Graph, Figure 1, below depicts overall knowledge of leprosy among practitioners based upon their correct answers. It was found that a total of 118 doctors, 45.03%, had a good knowledge, whereas 26, 9.92%, doctors had poor knowledge about the disease. 94 out of 262, 35.87%, had average, whereas 24 out of 262, 9.18%, had excellent knowledge. Overall ratio of correct answers was higher among postgraduate students in various disciplines as compared to doctors working as medical officer. Discussion. Leprosy is a chronic disease prevalent in India country since ages and is popularly known as Kushtrog in Hindi, national language. It is essential to have effective implementation of various control and eradication programs, specialized centers throughout a nation, and more importantly, where the disease is endemic. In Indian LEP, National Leprosy Eradication Program, has done a lot to curb this disease, but still a lot needs to be done further so as to bring it under control. Medical officers, MOs, are the first point of contact with patients and in turn serve as a source of first referral to higher centers for further management. Therefore, it is desirable that these clinicians should have adequate knowledge about the disease. Leprosy is a neural disease characterized by hypopigmented, hypoesthetic patches with nerve trunk involvement. Itching and pain, excluding reactions, are not the part of disease per second. However, 50% of the doctors answered the question related to this incorrectly, which signifies that they are not in a position to differentiate between characteristic patch in a leprosy patient from a lesion of some itchy dermatoses in other patients. Scaling is not the feature of leprosy except if we consider reactions. About 68% of doctors gave incorrect answer, thereby reflecting that they would have difficulty in differentiating between an inflammatory cutaneous condition and a lesion seen in leprosy patients.